Hello everyone, in today's session we'll be learning about the muscles of the gluteal region as well as posterior compartment of the thigh through the anatomy decoded notes. Okay, so let's begin. Muscles of the posterior compartment of the thigh, they are present in which part? Okay, here we can see the right sided lower limb from the posterior aspect. Muscles of the posterior compartment of the thigh are here, and this is the region of the muscles of the gluteal region. Okay, in the previous sessions we had covered about the muscles of anterior compartment, medial compartment. If you all have not seen those videos, please watch that. So till now we have covered these muscles. Okay, anterior compartment of the thigh, vertebro-iliofemoral, and the medial compartment of the thigh, and these two sets will be covering now. Okay, so first let us start with the gluteal region. So muscles in the gluteal region can be seen in this image. Okay, so here we can see a very large muscle, that's the gluteus maximus muscle. Okay, when you reflect the skin of the gluteal region, this is the first and the large muscle that you would see. This is the gluteus maximus muscle, and once we cut and reflect the gluteus maximus, deep to it is the gluteus medius muscle, and there is a muscle deep to it that is referred to as gluteus minimus. Okay, so layer wise, superficial to deep, three gluteal muscles are there. Then just inferior to the gluteus minimus, there is one important muscle called as the piriformis muscle. This muscle is referred to as key muscle of the gluteal region because there are many vessels and nerves which are related above and below the piriformis muscle. Okay, so it helps in identification of those structures. Okay, then as we come below, here we can see three muscles together. They are labeled here. Those are superior gemellus, obturator internus, and the inferior gemellus. Okay, so the two gemellus and the obturator internus. There is a tendon of obturator internus between the two gemellus. Okay, and as we come down, we encounter this muscle. This muscle is quadratus femoris. Okay, because the shape is quadrangular. Okay, the muscle in the anterior compartment of the thigh was called as quadriceps femoris because it was having four heads, like four parts it was having. Okay, and this muscle is named based on the shape. Okay, so all these muscles will be learning now with its proper headings like origin, insertion, nerve supply, and actions. Okay, so here the first muscle is gluteus maximus muscle. So origin of gluteus maximus is from the gluteal surface of the ilium behind the posterior gluteal line. Then on the dorsal segment of the ilium, there is an outer sloping surface. Then fascia of the erector spinae muscle. Then lateral margin of the coccyx bone, as well as the sacrotuberous ligament. Okay, so it has got an extensive origin. Muscle we can identify here. Okay, this muscle is gluteus maximus. And look at the insertion of gluteus maximus. 3/4 part, maximum part is going in the iliotibial tract. What is iliotibial tract? It is a thickening of the deep fascia on the lateral aspect. Okay, deep fascia of the thigh thickens on the lateral aspect to form iliotibial tract. Okay, and 1/4 of gluteus maximus, it goes in the gluteal tuberosity. It is present in the femur. Okay, gluteal tuberosity is a part of femur. Then nerve supply is inferior gluteal nerve, and action is, it is a chief extensor of the hip joint, as well as it assists in getting up from sitting position. Okay, so this was about gluteus maximus, a very important question, many a time asked as a short note in your theory exam, as well as in practical exams you are supposed to identify and cover all the headings which are mentioned here. Okay, the next muscle is gluteus medius, again arising from the gluteal surface of the ilium between the anterior and the posterior gluteal lines. Okay, then insertion is on the lateral surface of greater trochanter. Nerve supply here is superior gluteal nerve. Okay, so for gluteus maximus it was inferior gluteal nerve. For gluteus medius as well as gluteus minimus, both are supplied by superior gluteal nerve. Okay, and actions of gluteus medius and minimus, they are also similar. That is abduction at the hip joint, medial rotation at the hip joint, and this is very important action which is called as prevents the sagging of the pelvis on the unsupported side during walking. Okay, details about this we'll learn in a clinical condition or a clinical test that is called as Trendelenburg's sign. Okay, then Gluteus minimus again on the gluteal surface of the ilium on the area between inferior and the anterior gluteal lines. Okay, so on the gluteal surface there are multiple gluteal lines. So for that, learn about the osteology of the hip bone, then you'll know about these gluteal lines. Okay, then insertion is on the anterior surface of greater trochanter. Nerve supplies superior gluteal nerve, and action we have discussed. Okay, the next muscle is piriformis muscle. I told you this muscle is the key muscle of the gluteal region, right? It arises from the sacrum. Okay, anterior surface of the sacrum, there is an E-shaped attachment of piriformis. Insertion is on tip of the greater trochanter of femur. Then nerve supplies directly by the S1 and S2 spinal nerves, also referred to as nerve to piriformis, and action is lateral rotation at the hip joint. Okay, if you see all the remaining muscles, they are having one common action, lateral rotation at the hip joint. These small muscles, these together are also referred to as short lateral rotators. So let's quickly cover all the other muscles. Superior gemellus arising from the external surface of the ischial spine. Okay. Then insertion is on the medial side of greater trochanter of the femur. Nerve is nerve to obturator internus. Okay, both the gemellus, they don't have their own nerve. They are supplied by the muscle which is close to it. Okay, superior gemellus is supplied by nerve to obturator internus, and inferior gemellus, if you see, it is supplied by nerve to quadratus femoris. Then obturator internus muscle, as the name suggests, internus. Okay, so it is the inner surface of the obturator membrane and the adjacent bone, and insertion is on the medial side of the greater trochanter. Then nerve is nerve to obturator internus, and action is lateral rotation. Okay, then inferior gemellus arises from the upper part of ischial tuberosity. Insertion is again on the medial side of greater trochanter. Nerve is nerve to quadratus femoris. Action is lateral rotation at the hip joint. Okay. The next muscle is quadratus femoris. Arises from the lateral part of the ischium, just anterior to the ischial tuberosity. Okay. Insertion is on the quadrate tubercle on the intertrochanteric crest of the femur. Okay. Posteriorly there is intertrochanteric crest. There is an elevation on it called as quadrate tubercle. Nerve is nerve to quadratus femoris. Action is lateral rotation at the hip joint. Okay, and all these muscles you can identify in the cadaveric images which are shown here. Gluteus maximus we had identified, deep to it, this one is the gluteus medius, deep to medius is this one, this is gluteus minimus. Then as we come down, this is the piriformis muscle. Then there are superior gemellus, inferior gemellus with obturator internus, they are labeled here. Okay, so this 5, 6 and 7, these are the two gemellus with the obturator internus, and this number 8 is quadratus femoris, that is again seen here. Okay, so this is the left sided gluteal region which is dissected deeper to identify all other muscles. Okay, and in most of the books you will find this muscle also in the gluteal region, tensor fascia lata, but it is not seen in this region. It is actually seen in the anterior compartment of the thigh. That's why we had already covered in the anterior compartment. It is included here because of its nerve supply. Superior gluteal nerve, which supplies the gluteus medius and minimus, also supplies this muscle, tensor fascia lata. Okay, now let's learn about the applied anatomy of the gluteal region. So a very important topic is this, intramuscular injections in the gluteal region. Okay, very frequently injections are given here in the gluteal region. Okay, and the area to give it is the superolateral quadrant. Okay, gluteal region we can divide into 4 quadrants. This is superolateral, then this part is superomedial, this part is inferomedial, this part is inferolateral. Okay, injection has to be given in superolateral quadrant. Why it is so? Because we can see one nerve here on the medial aspect, there is the sciatic nerve. Okay, if we try to give injection in the medial part, the sciatic nerve may get injured. Okay, so that is the reason why injection is given in the superolateral quadrant, and it is usually given in this muscle, gluteus medius muscle. Okay, because the upper border of the gluteus maximus lies here, and there is some part of gluteus medius which is exposed just beneath the skin. Okay, and this is the way you can identify that spot and give the injection. Okay, index finger you can keep on the anterior superior iliac spine, and middle finger you can keep on the elevation, that is the tubercle of the iliac crest, and between them, between these 2 points is the safe site for the injection. Okay, so this was about the intramuscular injections in the gluteal region. Then this topic we had discussed the key muscle of the gluteal region. Which muscle is that? That's the piriformis muscle. Okay, because it provides a guide to identify the muscles, vessels, nerves in this region. Okay, then this sciatic nerve is in close relation with the piriformis muscle, and there is a syndrome associated with it called as piriformis syndrome. Whenever there is spasm or hypertrophy of the piriformis muscle, it can compress the sciatic nerve and can lead to pain and numbness in the buttocks. Okay, and usually individuals who do sports activities like ice skating, cycling, they are more likely to develop this syndrome. Okay, then there is a very important test called as Trendelenburg's sign. Okay, try to understand this Trendelenburg's sign with the images shown here. Okay, image A is a normal person standing with both legs on the ground. Okay, image B shows a person standing with the left leg has been raised. Okay, if the left leg is raised, this sided pelvis is supported by the gluteus medius and minimus muscle of this side. Okay, so right sided gluteus medius and minimus, they are contracting to keep this pelvis stable. Okay, supposing this gluteus medius and minimus gets paralyzed, see what is happening. If the left leg is raised from the ground, there is sagging of the pelvis on the healthy side. Okay, here the gluteus medius and minimus are normal, but still it is sagging because the action gluteus medius and minimus we had learnt, it prevents the sagging of the unsupported side. Okay, so once you understand it, then after that when you read it, the explanation would be much clear. Okay, both gluteus medius and minimus, they prevent the unsupported side of the pelvis from sagging during walking. Okay, thus maintaining a horizontal level. And when these muscles get paralyzed, and why would they get paralyzed? When there is injury to the superior gluteal nerve, the nerve which supplies these muscles, right? The pelvis sags on the healthy side. Okay, so that is shown here. Okay, and the resulting gait, the way in which the patient walks, is referred to as lurching gait. Okay, a frequently asked multiple choice question, lurching gait is seen in injury to which muscles? The answer would be gluteus medius and minimus. Okay, injury to the superior gluteal nerve basically will paralyze these muscles. Okay, and clinically if the test is positive, it is referred to as Trendelenburg sign positive. Okay, this topic separately is also asked as a short note many times. Make sure you practice this topic very well, and it may be asked as a clinical anatomy spot for you all in practical exams as well, where you're supposed to identify the sign and the muscles responsible for them. Okay, now let's move on to the next topic. Okay, so now we are starting with the muscles of the posterior compartment of the thigh. So look at the muscles which are seen here. Muscle here is biceps femoris, which is having a short head as well as a long head. Okay, so this is one muscle, biceps femoris. Then there are two more muscles, semimembranosus and semitendinosus muscle. Okay, why are they named so? Semi means half. Okay, half of the muscle will look like a tendon. Okay, lower part of semitendinosus is tendinous. Okay, and semimembranosus, if we see upper part of the semimembranosus muscle would look like a membrane. Okay, in actual dissected specimen, you can try to identify them. Okay, and get oriented towards the location of these muscles. Biceps femoris lies on the lateral aspect. You're looking from the posterior aspect. Right-sided thigh, you're looking from the posterior aspect. And semitendinosus and semimembranosus, they both lie on the medial aspect. Okay, and all these muscles, they are arising from this part of the hip bone, that is the ischial tuberosity. Okay, and if you see carefully, they are crossing the knee joint and going to the tibia or the fibula. Okay, so the muscles of the posterior compartment of the thumb are also referred to as hamstring muscles. Okay, we'll discuss what are hamstrings. Let's start with the muscles with and cover all the basic headings. Okay, origin, insertion, now supply and the actions. So biceps femoris means it is having two heads of origin. Long head arises from the inferomedial part of the upper area in ischial tuberosity. Okay, in the ischial tuberosity, if you see, there is an upper quadrilateral area, lower triangular area. Okay, in the upper quadrilateral area, there is one area called as the inferomedial part. Okay, and insertion, it is going up to the head of the fibula. And nerve supply, long head is supplied by tibial part of sciatic nerve, and short head is supplied by common fibular part of the sciatic nerve. And actions of biceps femoris is flexion and lateral rotation of the leg at the knee joint, as well as extension of the thigh at the hip joint. Okay, so these muscles are crossing the hip joint and the knee joint, so they are acting at both the joints. Okay, then look at the semitendinosus. It is also arising from the inferomedial part of the upper area in ischial tuberosity, just like the long head. Okay, long head of biceps femoris and semitendinosus, they have a common origin. Okay, insertion, it is going up to the upper medial aspect of the tibia. Okay, along with two other muscles we have learnt in this region. One was gracilis and other is sartorius. Okay, nerve supply is tibial part of sciatic nerve, and action is flexion and medial rotation of the leg at knee joint, as well as extension of the thigh at the hip joint. Okay, the next muscle is semimembranosus. It is arising from the superolateral part of the ischial tuberosity. Okay, then insertion is on the groove on the posterior aspect of the medial condyle of tibia. Okay, medial condyle of tibia posteriorly has a groove where there is insertion of semimembranosus. Now supplies tibial part of sciatic nerve, and action is similar to the muscles that we have learned, flexion at the knee joint as well as extension at the hip joint. Okay, then adductor magnus muscle, one part is coming here, that is referred to as hamstring part of the adductor magnus. Okay, so this muscle was not shown in that image because previously we had seen in the medial compartment of the thigh this adductor magnus. Okay, so this is referred to as hamstring part of adductor magnus, which arises from the inferolateral part of the ischial tuberosity. Insertion is on the adductor tubercle of femur. See, this muscle is not crossing the knee joint, so it will not act at the knee joint. Okay, so it is acting only at the hip joint. Okay, now supplies tibial part of the sciatic nerve. Okay, then applied anatomy of this topic, we discussed what is hamstrings. Okay, hamstrings includes the long head of biceps femoris, semitendinosus, semimembranosus, and the hamstring part of adductor magnus. Okay, all these muscles are included in hamstrings. Okay, so biceps femoris, only long head is included. Okay, short head of the biceps femoris, if you see, it is arising from linea aspera, a part of the femur. Okay, remaining all muscles are arising from the ischial tuberosity. Okay, so there are some characteristic features of the hamstrings, so that is mentioned here. The proximal attachment will be from ischial tuberosity. Distal attachment is on one of the bones of the leg, either tibia or the fibula. Nerve supply is by the tibial part of the sciatic nerve, and action is extension at the hip joint and flexion at the knee joint. Okay, these are general characteristic features of the hamstrings. And there are two muscles which are referred to as true hamstrings. Those are semitendinosus and semimembranosus. Okay, they qualify all the characteristics of the hamstrings. Okay, so now the question arises, why biceps femoris and adductor magnus, they are not included in true hamstrings? Okay, so the reason is mentioned here. Origin of biceps femoris was from sacrum before evolution. Okay, that part is now persisting as the sacrotuberous ligament. And insertion of hamstring part of the adductor magnus, it is at the adductor tubercle of the femur. That part is distally extending to the tibia as the tibial collateral ligament. Okay, so that is the reason it was included in the hamstrings, but its actual attachment, which is seen here, that's the adductor tubercle of the femur. Okay, so because of these reasons, the biceps femoris as well as the hamstring part of adductor magnus are not included in true hamstrings. Then there could be paralysis of the hamstrings, in which the patient will tend to fall forwards because the gluteus maximus muscle cannot maintain the necessary tone to stand upright. Okay, extension at the hip joint is required for standing upright, and gluteus maximus chief action is like getting up from the sitting position. Okay, for initial extension it helps, but for prolonged standing, the hamstrings help in extension at the hip joint. Okay, Then there was a term called as hamstringing the enemy. Okay, in ancient times, the soldiers used to slash the back of the knees of the horses of their opponents to cut the tendons of the hamstring muscles. Okay, so this brought the horse and its rider down, and they also used to cut the hamstring tendons of the soldiers that so that they could not run. This was referred to as hamstringing of the enemy. Okay, so all these are important applied aspects, and you may identify those muscles in this cadaveric image. So as we can see, this is the lateral part. The muscle on the lateral aspect is biceps femoris. So this one is the long head arising from the ischial tuberosity. Then on this side, we can see muscles on the medial side. They are semi-tendinosus as well as semi-membranosus. Okay, and also a part of adductor magnus is seen, the hamstring part of adductor magnus. All these muscles are there in the posterior compartment of the thigh. Okay, so make sure you cover all the headings: origin, insertion, nerve supply, and actions, and related applied anatomy. Okay, so this was all about today's session, and this is the QR code that you all can scan and get access to all our notes. Thank you.